'Tis the season to pick a health plan. Hi, everyone, and welcome to HiFi Health News. I'm Erika Grotto. If you've been staring at your HR paperwork wondering what kind of health plan to pick for next year, don't worry, I've got your back. Recently, I spoke with Justin Held from the International Foundation of Employee Benefit Plans. He shared 5 tips to picking the right health plan.
The first step, obviously, number one, read your enrollment materials. Very important. They're going to explain the differences between the types of plans available. They're going to offer a comparison of coverage levels, out-of-pocket costs, and any other costs that you might expect to incur. The second step is the most difficult step, and that's just doing the math. So take your out-of-pocket spending, what you're projecting to pay for the year, add that to your premium that's going to be deducted from each of your paychecks to see what that total coverage cost is for your plan year. And also just a quick note here, keep in mind that there's going to be separate copays for your prescription drug spend as well. So just another complication to throw on top of the pile here. So the third thing that we'd like to consider is finding out what treatments, what services are covered, and whether the providers that you typically use are already in your network. So which of your plans cover chiropractic care? How much will your maintenance medication cost under all those different plan options? You might have a long-standing relationship with a specific doctor or a specific health system or provider. Will you pay more to be with that doctor specifically? Just lots of considerations on the treatment and services side. Number 4 is risk. How much risk are you willing to bear as an individual or as the sort of the breadwinner for your family? If you want every expense to be covered, a traditional plan might be the right choice. You're going to pay a higher premium, but the plan is going to cover a lot more of those costs up front, which is fantastic. And if you don't go to a doctor a lot, if you're younger, a high deductible health plan that charges smaller premiums might be a better fit. So just remember that your out-of-pocket expenses will be higher. So make sure to budget for the unexpected when you're dealing with those high deductible plans. And finally, number 5, just considering your own health and your family's health. Do you have any chronic conditions? Are you planning on a large expense in the next couple of years? Are you planning on having a baby, starting a family? It's very important to compare what those plans cover and what the cost is going to be from your perspective. So
There's so much more to this conversation, so be sure to subscribe so you can get every bit of it. I'm Erika Grotto for HiFi Health News. Thanks for watching.